I grew up out this way, so I've seen changes, not just what we're about to see in intensive care at Dubbo into the new unit. I was here as a junior doctor when in the previous unit and the previous emergency department, and I also grew up out here as a boy, so I've seen Dubbo grow from the signs into town of about 28,000 population to what I think is probably in excess of 50,000 population now in the surrounding areas. So I have some family growing up experience here. I came here as a junior doctor to work almost exactly 25 years ago, and in more recent years I had the opportunity to come back on a regular basis to work in the intensive care unit again here at Dubbo, as this time as a specialist. It's rewarding in the sense that the hospital itself is big enough that you see everything that you need to see in terms of career satisfaction or case mix, but the hospital's small enough that you know everybody else in the hospital. So what that means in terms of dealing with your medical, surgical, anaesthetic, emergency physician, obstetric colleagues is that you know all of these people quite well. And with that relationship, it makes it a lot easier in dealing with patients. People tend to be very supportive of each other, and there's a clear focus on making sure that when we're in trouble with someone who's unwell, that people work very well together to try and deal with that. So that's just the medical staff. I think you also, in a place this size, tend to know the nursing staff around the place and the allied health staff around the place, the clerical staff around the place. Everybody tends to get to know each other, and that makes it a very warm and friendly place to work. So, but particularly from a primary medical work point of view, the collegiality is really special in a place of this size. The other things that make us satisfied for me as a specialist are that, certainly compared to when I was a junior doctor here 25 years ago, the middle grade of residents and registrars, and that includes training registrars, has grown enormously. So that's very helpful as a specialist in terms of having those people to help you with the work, but it's incredibly rewarding for me as a specialist because they are keen and enthusiastic. They like to be taught. The education programs that are in place for them and the ability to teach and learn, both me to them and also from them to me, is great. So they rotate through some of the Sydney hospitals, but there's also a good bunch of local people who work here. So the middle grade registrar resident staff are great. The other thing I'd say about the registrars is that because a number of them rotate from hospitals like Prince Alfred, it also gives us a professional link with hospitals like Prince Alfred. So I not only enjoy collegiality here, I enjoy a working relationship with a number of specialists and the trainees at the larger hospitals, for example Prince Alfred in Sydney. And that can be very helpful at times. You don't feel, at least I don't feel here in any way, that I'm isolated from collegial support. And certainly compared to 25 years ago when I worked here, the advent of things like telehealth, video links, just even simple things like mobile phone technology has made us essentially all virtually next door. So the opportunity to tap into the resources at bigger hospitals when you need to do that, that's really straightforward. They also tend to be very supportive of you in a rural area, which is fantastic.